My name is Steve Rosenthal, and I'm the Senior Vice President for Population Health Management for the Montefiore Health System, which is an 11 hospital system in one of the boroughs of New York City, the Bronx, and extends north into what we call the Hudson Valley. With a population of almost 800,000 individuals who are on public assistance or in the Medicaid program, roughly almost half of that population are children under the age of 18. And so one of the methods that we've used over the years is becoming very much engaged in the school system. The Bronx has about probably somewhere in the neighborhood of 120 schools throughout the borough. And Montefiore provides full primary care services in 41 of those facilities, where we actually have physician, nurse, who are there almost full-time, practicing in that environment, supporting the children, and of course, very often have to include the family in some of those activities. But it's very difficult to get the young men and young women into a clinical office, and so the opportunity to get them in the school system has been very, very positive. And as you know, one of the challenges, particularly in the lower socioeconomic category of folks, is that many of the adolescents are overweight. Obesity in young men and women is quite significant in the Bronx. And so we've developed many important programs. One of the things that we noticed was there was no easy access to fresh fruits and vegetables in the Bronx. So working with New York City, we began to create a series of kiosks that were placed strategically around the borough that offered fresh food, fresh fruits, and fresh vegetables from various farmers in upstate New York who were willing to sell it at a very reasonable price. And then we also worked with many of the bodegas, which are the small neighborhood grocery stores, to begin to move out some of the dollar French Corollas and donuts and other kinds of foods that were not helping us, and replace them with vegetables and healthy snacks. Because when the kids came home from school, that was their first stop. The Bronx actually was the epicenter of the first significant exposure to the virus. And so very early on, we had large numbers of patients with COVID in our facilities. I often say that on March 11th, we had 2 patients in the hospital with COVID, and then on March 31st, we had 1,009. So a very steep, rapid climb of patients with this horrible virus. And what we learned very quickly was that the challenges were not so much in the hospital, although of course early on we didn't know pretty much what to do with the disease. So it was much more challenging. We discharged almost 7,000 individuals during the course of the peak of our epidemic, but unfortunately almost 25% of them passed away. So it was quite a difficult time for many of the clinical staff as well. But what we were able to do was recognize that once these individuals came into the community, they needed some very important social connections. And the most important one turned out to be food. And so working with charity agencies, the City of New York, and many other philanthropy groups, we began delivering food to people's homes. And that was one of the key tools that we used to sustain individuals and keep them from coming back into the hospital for unnecessary readmissions. Understanding the population that you're servicing is often data-driven, because you want to understand, one, who and where they are, what are the services that they need, what services are available to them in the areas that they do live, so that you can make connections. And then you want to be able to measure your impact. So some of the ways that we've looked at measuring our impact on whether we're having a positive effect, and both before COVID as well as during COVID, is that are we effective in keeping people away from unnecessary services? There's no good things that happen in hospitals, really. And if we can keep them from coming back for that second or third visit, that became a real important opportunity. And then working with community agencies became critical as well, because as you know, the social determinants are really the biggest challenge for the poor, because they don't have ready access to many of those things that require resources. So whether it's things like transportation, food, or other financial assistance, we needed to make those connections to keep them from those places that were only going to create additional challenges.